Ooh. Start with me.
Hello you guys, welcome back to Tuesday Tips. This is our weekly check-in. We discuss different topics in plastic surgery and I get to answer your questions. We meet every Tuesday afternoon, so don't miss it. Today we're going to be continuing our What to Expect series. So we've been doing this for the past few weeks. The What to Expect series is more focused on patient experience. What things do you feel after the surgery that a lot of patients are sometimes scared when they experience it. And most of the time, it's actually very normal and very expected. So we'll go over some of the things and then I'll get to answer your questions. And today we have a special discussion about the new Florida laws. So we'll go over that it was just signed a couple of weeks ago and it was in effect July 1st. So let's talk about liposuction first, okay? So what to expect liposuction. This is a review of a lot of my procedures combine liposuction, not only a liposuction itself, lipo 360 case, but if, for example, if you're doing a mommy makeover, we do liposuction to the flanks. If we're doing tummy tuck, if we're doing sometimes breast procedures, we combine it with lipo. A BBL is liposuction 360 with fat transfer to the bottom of her hips. So this one is important because it's involved in most of the procedures I do, okay? So what's liposuction? Liposuction is basically emptying the fat, okay? I don't remove any skin, so it relies on the patient's skin to retract to get the final contour, okay? And liposuction or liposculpture or HD, ab etching, all of that is different modifications of liposuction, okay? So ab etching or high definition, it is just making different thicknesses of liposuction to create images or shadows that represent the muscles, okay? So the important part about HD and ab etching is that you have good skin quality, okay? But because it relies on the skin attaching and retracting so you can see those differences and those shadows, okay? So what to expect? This few things that I put here in the board are very, very common after liposuction, and patients usually get very scared when they start experiencing this. So the number one is dizziness and lightheadedness. Okay, so people wake up from liposuction, it's like, I feel very weak, I feel dizzy. What happened here? Incisions are so small and this was like a 2-hour surgery. Why do I feel so beat up? So even though it is small incisions, remember that liposuction, the extent of the surgery is your entire torso, okay? So when I'm doing liposuction, I'm basically emptying the fat in the entire abdomen, back. It's a large area. So large area of surgery involves large trauma to the skin and subcutaneous tissue, which that relates to an inflammatory response in your body that goes up. Once that inflammatory response goes up, there's a lot of cellular mediators. Your cells start to release proteins and factors to heal, okay? And that involves basically creating a leakage of fluid in the tissue itself, and that's what causes swelling, okay? So even if you bump your hand, you get swelling afterwards. So that swelling is that inflammatory response that your body does to send all the healing cells, proteins, and all that's needed. Just imagine that bump, but in the entire torso, okay? So between the response of the massive response of inflammation that your body goes through to try to heal that entire surface area, also I'm removing fat, okay? So imagine that I go and to put yourself on a diet and lose 4 liters of fat, we're talking about a lot of effort and a lot of time, okay? We're doing this in a 2-hour window, 4 liters of fat, okay? So imagine like a liter of Coke or water, 4 of those of fat, okay? So that is, your body is gonna feel severely dehydrated. It's like all of that was here and now I lost it. So with the inflammatory response, on top of that, the 4 liters of fat that was removed, and obviously some blood that you lost along the way, because with the liposuction, even if we do epinephrine and tumescent fluid, that I'll talk about that to decrease blood loss, there is blood loss involved. So you lose blood, hemoglobin, fluid, and also the inflammatory response. So it's very common that you do feel dizzy and lightheaded, okay? How long does this last? Usually a couple of days, okay? So the first 1 to 2 days are the ones that you feel more tired. And then there's something called redistribution of fluid, okay? And this happens after any surgery, usually at day 3 or 4. Remember that I talked about the bump in the hand, all that fluid going to an area? So there's something called the third spacing, okay? So we have blood and fluid inside of our blood vessels, and then with inflammation, all those cells need to go to the tissues, right? So that fluid goes to the tissues to get the cells, the proteins to fix. By 3 to 4 days after the surgery, all of that repairing, like initial repair, it started, and now that fluid goes back to your bloodstream, okay? And that third spacing, which is called that fluid that it's in your tissue, is coming back. So you get a dilution of your hemoglobin. So you kind of, it's like, Dr. Vidal, I was feeling a lot better, but then now I'm 3 to 4 days out and I'm feeling a lot tired now. Yeah, now you have to pee all that fluid. I bet that first few days you weren't peeing that much, and then in the 3rd and 4th day, I'm going to the bathroom 10 times, because all that fluid that was in your tissues now is going back to your bloodstream and into your kidneys, so you can eliminate that and your swelling starts to come down. But it's a process, it takes time. So what to do with this? With this, hydrate, okay? So the second one is, this is the most important thing for you to do after liposuction, is your hydration. How much? At least 1 gallon of fluid a day, okay? 1 gallon, that's a lot of fluid, okay? That's 4 liters, okay? So it is not enough to drink 1 glass of water. It is not, okay? And it is very common that after liposuction, you feel that you get full easily and that you don't have an appetite, okay? This is a combination of the anesthesia and also your garment. You're so tight that you drink just a little bit and you're full, okay? So it's important that you plan ahead, okay? And just sip throughout the entire day. You sip, so you can try to get to this gallon. The gallon of fluid is majority of it water, but also incorporate electrolyte drinks like Gatorade, Pedialyte, those are good. Pineapple juice helps a lot with the swelling. Pineapple has bromelain naturally, and that bromelain helps with decreasing the inflammation, okay? So hydration, very, very important. Leakage, this is a very, very common concern, and also a common thing that scares patients, okay? What's tumescent fluid? So to understand the amount of leakage that you'll have, you need to understand what's tumescent fluid. So because when I'm doing an open surgery, I have a device called an electrocautery, and that basically coagulates the blood, so we decrease the blood loss. When I'm doing liposuction, everything is closed. I'm not coagulating, I'm not using an electrocautery, so I need to use a medication to cause vasoconstriction, to decrease blood loss. So the vessels kind of constrict and the blood loss is less. And that is done with the tumescent fluid. It's 1 liter of saline with epinephrine, which is a medication that aids on vasoconstriction, okay? But we're talking about a very large surface area, right? So more or less, for every liter of fat removal, I'm injecting 1 liter or one and a half liters of tumescent fluid, okay? So if I'm removing 4 liters of fat, I'm injecting 4 to 5 liters of tumescent fluid, okay? That fluid tends to come out partly with liposuction, but the rest is gonna start leaking after surgery, okay? So I leave a drain, 1 drain with my liposuctions to help get all that fluid out. Massages are extremely important to try to get that fluid out. but also it's gonna leak, okay? And because it's mixed up with blood, so even if you take a glass of water and you put a drop of blood, the glass turns red, right? It's the same thing. It's even one drop of blood, it's gonna seem that the fluid is red. So a lot of patients get very scared thinking they're bleeding out after their liposuction because they see it leaking out through their body. They kind of go to the bathroom and it leaks down to the floor. They get scared, they call, I'm bleeding out, what can I do? Don't worry, just keep your compression. The compression, it's gonna help with that leakage. Now I'm not having the patients wear it for the first 24 hours to avoid lipo burns, but just let it leak, okay? Is that fluid? You're not bleeding out. It's not dangerous. It's just your body getting rid of that excess fluid, okay? So don't worry about this. This usually lasts 24, 48 hours. Massages are very good to try to get that out, and you'll see that, you know, the first 24 hours you'll be leaking everywhere. Then at 48 hours with the massage, you'll see a lot of that fluid coming out, and then day by day it will decrease until you don't see any leakage, okay? Massages. If this is number one, this is number two on the important things after liposuction. So remember I mentioned it's a large surface area. That surface area accumulates fluid, so we need to get all that drained, so your massages are extremely important. This is a simple rule. Everybody's different. Everybody's number of massages is going to differ immensely, but this is a general rule that helps you kind of plan ahead. I always tell my patients at least 20 massages in the entire post-op course, but it's like, but how? Do I have 20 massages in the first week, or how do I do this? So the 7-7-7 rule it's good, okay? It's a good organizing yourself, okay? So set the first 7 in a row. So for the first week, you're gonna have 1 a day, and that is 7. The next 7 every other day, okay? So that's gonna take you 2 weeks of every other day. Day massage, you rest. Massage, you rest. After the 3rd week, which is you did 1 week of this, 2 weeks of this, then you get to the last 7 massages, and at that time, probably can do 2 a week, every 3 days, every 4 days, until you stop them. Again, everybody's different. If you had lipo previously, if you have a lot of loose skin, if you have a lot of fluid buildup, okay, and that is not related to any surgery itself, it's just your body. Everybody's bodies are different, and everybody metabolizes fluid and surgery differently. So, you know, everybody's different, but this is a good rule to follow. Usually, you should, if you are traveling to Miami to have the surgery, you should have the first 7 or the first 5, because you're going to be here 5 to 7 days. Those first you should have, okay, after just planned ahead before, and usually the rest you can continue back home, okay? Swelling, you are gonna be very swollen. I've said this in so many videos, in every patient consultation, you are gonna be swollen and bruised after liposuction, and I think 95% of the patients I see post-op are like, I know you said I was going to be swollen, but I did not expect I was going to be this swollen. You're going to be very swollen, okay? And the swelling, yes, is going to be in the surgical areas, but also everywhere, okay? Remember I mentioned about this inflammatory response that your body goes through that sends, you know, cells everywhere, that leaks all that fluid out of the blood vessels. This happens in your entire body. It's what's called a systemic inflammatory response. And systemic means everywhere. So your eyes get puffy, your hands get puffy, it'll go down. Your body just needs time to kind of adjust and will go down. How long am I going to be swollen? This is the next most common question. It's similar to the massages. I can't give you a certain number, but I can give you an estimate. So the first 2 weeks are going to be very, very, very swollen. Very, very, very swollen. Then you start to see a silhouette. At 2 weeks, it's like, okay. At 6 weeks, it's like, okay, I'm seeing a good result, but then it's like, Dr. V, I wake up one day and my belly is flat, and the next day it's like all bloated. I don't understand. The swelling doesn't go down linearly, okay? Fluctuates. So you are gonna have days that are more swollen, days that are worse, better, and until it gets better, okay? So 6 weeks, you are less swollen, but they're still a lot of swelling there, okay? 3 months, you see close to a final result, but swelling in certain people, especially tummy tucks, may linger up to a year, okay? So you are gonna get swollen. Sensation-wise, this is another very common, okay? With the cannula, nerve endings get traumatized, so at first you are numb. It's you don't feel. It itches, but you scratch yourself, you don't feel anything. It will come back, okay? It just takes time. And the other thing is the burning, itching, pins and needle, all of that is kind of your body's response to the healing of the nerve endings. So that gets better, but usually by 6 weeks you see an improvement. 3 months should be close to normal, okay? That's pretty much with liposuction, and I wanted to talk about the new Florida laws, okay? So let's talk a little bit about this. So you've heard that last year there was an emergency rule passed that lasted 90 days regarding the use of the ultrasound with BBL. Well, that lasted 90 days and it passed. So the legislation had been meeting and putting a certain laws, not an emergency regulation anymore, a law that just passed about 2 weeks ago, and it started being effective July 1st. So what are these new laws in Florida? It's not a suggestion, it's not an emergency rule, it's a law. So by law, any surgeon in the state of Florida performing a BBL needs to use an ultrasound to transfer the fat over the gluteal muscle, okay? I've been doing that. I do all my BBLs under ultrasound guidance, and I think that ruling, that law is gonna significantly promote safety in this surgery, that it can be a safe surgery to perform if it's done by the right person and also by visualizing where you're injecting the fat. So definitely, I think it is a very, very good thing. And there are other things included in that law regarding when you meet your patients. So it's not going to affect, again, my practice, but the law says that you need to meet your patient at least 24 hours before the surgery, which is not gonna, I meet all my patients beforehand and I see you the day before for pre-op, so it's not gonna change anything, but that is also included in the law, okay? So, and I have a little picture here to share with you guys regarding the ultrasound. If you haven't seen it, if you haven't heard about this before. So the ultrasound is basically a device that is used for many things in medicine. Is a radiological machine device that it's used most commonly to see your baby when you're pregnant, right? That's the most common use, but it's used throughout the body by radiologists to see different layers, okay? Different probes of the ultrasound lets you see different thicknesses, okay? So the one that we use is called the soft tissue probe, okay? That lets you see the layers of the skin and the muscle, okay? Which is very useful because when we're injecting the fat, that's what we want to see, right? I don't want to see the bone. I don't want to see the bowel. I want to see the layers of the skin, okay? So this is what I'm seeing when I'm doing the ultrasound. This is a picture, okay, of a patient that I did, and basically the thickness in the, let me see, okay, yeah, those dots that you see on the side there, each big dot, it's a centimeter, so the entire thickness of what you are seeing from the skin deeper, it's 4 centimeters, okay, so it's like this, so that's zoomed in to 4 centimeters. And you can see the different layers, okay? For a lot of you guys, it's like, I just see like shadows there, but if you know what you're looking for, this is what you're gonna see. Down here, so the probe is up here, okay? So the first layer is the skin. The skin is this layer here, okay? Then this like grayish, okay, more like cloudy, okay? Then you see that it's black, right? That black is fat, okay? The fat looks black. Then you see those lines that are white. Those are the fascia, or the layers that divide the superficial fat from the deep fat. Then you see the muscle that it's like a little bit more cloudy, and the lines are more, it's striated muscle, so they're a little bit more close together, okay? And it tends to look a little bit more cloudy. And this line, this is a picture, remember. So when I'm doing it, I'm moving the probe and I'm seeing live the different layers to see it clearly. And usually this line, you can see it very, very clearly. That's the fascia. So nothing, the fascia of the muscle, okay? So the muscle fascia right there, that below, that's where it's the danger zone. You shouldn't inject fat there, okay? This white thing that you're seeing right there, that's the cannula, okay? So when I put my cannula in, I go with the ultrasound, I'm seeing that my cannula, it's above the fascia, in the deep subcutaneous space, so in the fat, and I'm starting to inject. And here you see the cloud of fat right there. You see like it's a little gray. And when it's live, I'm actually seeing in real time the fat going to the subcutaneous space and expanding. And you see how this space expands with fat and it fills in, okay? So it doesn't leave any room for uncertainty, for mistakes, for the angle was a little deeper. Everybody's anatomy is different, okay? So every muscle curve, every skin, everyone is a different size outside and inside, okay? So having this as a new rule and as a new law here in Florida, I think is going to protect a lot of patients. And I advise everyone, and this is in Florida, remember, okay? So if you still decide to do a BBL outside of Florida, you should look for a surgeon that's using ultrasound guidance for the BBL, okay? There's a lot of surgeons that say that because I've done so many, I have good experience, I know where my cannula is, but what better way of seeing it, right? It's not leaving it to my touch, my anatomy. No, I am seeing it. There's no room for mistakes or misinterpretation, okay? So that's the new ruling. Again, nothing that's going to change with my patients because I do this with every single one. But if you are doing a BBL, do your research to find a surgeon that is using this to keep you safe. Let's get some questions.
Okay.
Yes.
With BBL revision, do you also use the ultrasound?
Yes.
And book for December?
Yes, that's awesome that you're coming up in December. But yes, definitely, whenever I'm injecting fat over the gluteal muscle, I'm using the ultrasound.
Great. Will it hurt the first time we see it at 6 weeks? What level of pain should we expect?
At 6 weeks after surgery is your question?
Yes.
You shouldn't have pain at 6 weeks after surgery. Pain usually is in the first week. Then you may feel sore, you may feel pins and needles of those nerve endings kind of growing back, but you shouldn't feel pain. When you sit down, so when you're sitting down, it may ache, okay? You haven't been sitting in the bottom area for 6 weeks, so it may ache a little, but it shouldn't be painful that you can't sit, okay?
I had a while ago back gastric bypass,
Okay.
and I noticed bad healing on my scars after the bariatric surgery. Will it affect on skin retraction after liposuction?
It depends. So I will have to evaluate your particular case to see what you mean by bad scarring. If you have skin laxity, that it's like kind of hooding over the scar of the laparoscopic incision, that may mean that you have skin laxity, and that may affect your liposuction results if the skin doesn't retract all the way, okay? If it's the scar itself on the outside, it depends. If you're keloid prone, there is an increased risk of developing fibrosis with patients that are prone to keloid, so massages are going to be super important afterwards.
Okay. I don't know if I suffer from low or high blood pressure.
Okay.
Does the doctor has the control of putting medication in case either comes up or down the pressure in the surgery?
No. So you should go to your primary care and have that evaluated during the pre-op process, okay? And if you are being started in a blood pressure medication, you need to be controlled prior to surgery, which means that if you're doing your pre-op clearance and they diagnose you with high blood pressure and the blood pressure is high and they're starting you in a medication, we may need to postpone your surgery for you to have a follow-up with your primary care, documenting that your blood pressure is now controlled under that new medication, and then you come to do your surgery under general anesthesia. Starting a new medication or giving you a medication just in case your blood pressure goes up and down is not safe. You should be with a medication established and have that level controlled prior to coming over.
She's our patient, so
Okay,
she should be ready for the surgery.
awesome.
Any supplements to take or foods to eat to prepare your body for post swelling?
Yes, yeah. So I start all my patients at least 30 days before with iron supplements, vitamin C, and folic acid, okay? All of those things are gonna optimize your hemoglobin levels and also help you with healing afterwards. In terms of swelling, you can take arnica after the surgery. Wait for bromelain, because straight bromelain, you can take it naturally through your pineapple juice, but straight bromelain may increase risk of bleeding. So at least 48 hours after surgery, you should stay away from bromelain supplements. But bromelain, arnica, gel, teas, oral, all those are good to help you with the swelling afterwards.
It's okay to work out and build muscle after a brachioplasty. I have a clean, straight incision.
That's awesome. Of course it is, yeah. So once everything is healed, so at least 6 weeks after surgery, you are clear to go back to working out, to the gym, and definitely you can work out the upper extremities. And because the excess skin is out, you're gonna be able to see that muscle very fast.
How do you know if body type is a success?
If body type is a success, that's a very personal answer, okay? So it depends on what are your goals, okay? So body type, it is an add-on to a liposuction, and it is basically radio frequency energy to the subcutaneous tissue to aid in skin retraction. It is not an excisional procedure, so there is not going to be a dramatic tightening of the skin like what you see with a tummy tuck, for example, okay? So if you would say that tummy tuck is 100% skin tightening because the skin is removed and everything is tightening down, body type will give you a 50% improvement. It all depends on your skin quality, your age, your post-op regimen, right? So, and your goals. If your goal is to have an improved contour, you may be happy with that body type was able to do. But if you're expecting it to be super tight, then you may not be happy. So the final goal is, 1, your expectations of the surgery, and 2, you have to wait at least 6 months to see a final result.
How often should you be walking during healing?
Very good question. Every hour for 10 minutes, okay? You need to get up and walk even the same day of surgery, okay? At night, you may have your rest. You don't have to be walking every hour and waking up every hour. But you shouldn't be sleeping more than 6 to 8 hours, okay? Because you have to wake up early so you can start up your routine again. Awesome. Thank you so much, you guys, for all the questions. Be mindful of the new rules, okay? And Willie wants me to remind you guys that I'm on Threads, this new platform, and I'm there. So follow me there. Go to Threads. Dr. Natalia Vidal is the same name as Instagram. You can find me there. If you follow me on Instagram, you're not following me on Threads. You have to go to the platform and follow me there, okay? And thank you so much, you guys. I'll see you guys next week on Tuesday Tips. Take care.